but I just wanted to cover a few technical notes as people continue to join. You are on mute as you enter. I will be pressing a button that will allow you to talk and unmute yourself when the time comes for question or conversation, but just be aware that you are muted, but just make sure you continue to stay muted to reduce background noise. And there is, if you are on the web feature, there is a chat box if you need anything from us. I will be monitoring that chat box, and there is also a Q&A box. You can put your questions that you have in either of those two boxes. I'll be monitoring both and responding there. But then when we get to the Q&A session, you'll be able to use the chat box or raise your hand and unmute yourself to ask questions. So we have a few minutes here before we begin, but just wanted to cover those items with individuals. Thanks.
Good evening, everybody. We are just waiting for just a couple of more seconds for additional folks to join. So I do appreciate your patience. I think Andrea shared with you just a couple of housekeeping items. So remember that there is the chat box and the Q&A box to be able to both chat and offer questions. So please feel free to utilize those functions. Additionally, during the Q&A portion, as I understand it, when you all came on, you are muted. Andrea or the CMF team, we will unmute you to allow you to ask questions. We do just ask, though, that while you are not talking, to please be sure to mute yourself so that we can limit the feedback noise that comes across. And again, we will be getting started shortly.
Quiet.
While we are waiting for Congresswoman Dingell to join us, I just wanted to really extend our appreciation for everybody's patience. I know that folks are running really fast and furious. And it has been a crazy time as we look to be responsive to this crisis that we find ourselves amidst in. And so just wanted to express my appreciation for everybody, or our appreciation for everybody as we look to respond to community needs. This is an opportunity for us to be able to hear from the Congresswoman regarding the Families First Coronavirus Response Act. And as you know, that act, the president signed it yesterday, and that goes along with an $8.3 billion emergency bill. There's also conversation around additional aid packages, so that will be forthcoming, as well as the work that the state of Michigan is doing. This will be a chance for us to kind of hear about all of those things and then be able to engage in a generative discussion around where gaps exist and the work that we're doing to, in part, help to fill those gaps. So that is what's on tap for this evening's conversation. And I'm just going to ask, has Congresswoman Dingell joined yet?
Regina, I am checking. I do not see the phone number.
So Tim, we just ask that you please be patient. We're actually just combing through the phone numbers of all the folks that have joined to make sure that we've got the appropriate folks unmuted for this call. So I do just appreciate your patience, and we will be back with you shortly.
Hello?
Hello, we are all on the line and just waiting for Congresswoman Dingell to be able to join us.
I'm here.
Oh, you are. Well,
I've been having conference call issues all day.
I'm glad that you are here. We have a robust group of CMF members and also partners on the line, Congresswoman. And I did provide just a kind of brief introduction slash overview for the conversation today. And so we're really excited that you're here to join us. Obviously, the circumstances are a bit grim, but really the intent of the conversation is to hear from you regarding the Families First Coronavirus Response Act, and then also what's next on tap as Congress looks to respond, and then a conversation about where the gaps are. Congresswoman, as you know from our membership and our partners, we're looking to be partners in the response efforts. And many of our members are already on the ground working in real time on this issue. And so the critical areas of importance have been around, and where conversations have been had around education, K through 12, early childhood, also food insecurity, certainly community mental health, and then support for the charitable sector overall. So I just wanted to provide that framing prior to hearing from you on the Families First Corona Response Act. So I'm actually going to turn it over to you now, Congresswoman.
Okay. Hello, everybody. And I was a few minutes late, and I apologize because I was on the phone with Speaker Pelosi. I saw some of you when you were in Washington as we were writing this bill and gave you sort of a sense of what we were looking at including. But I'll do a quick what's in the Families First Coronavirus Response Act and then talk about, there are a whole lot of issues still remaining, and the issues, quite frankly, escalate every day. But what was in the bill that was finally signed by the President yesterday, day before, I'm losing sense of time. One, there was free testing for the coronavirus. So the bill ensures that anybody who needs a test, including those with private insurance, Medicare, Medicare Advantage, Original Medicare, Medicaid, CHIP, the VA, TRICARE, et cetera, as well as anybody who doesn't have insurance, that doesn't have anything, that they will be given the test at no cost. So it really addresses people who may be sick, who, you know, when we were doing this, restaurants, and that we hadn't seen the kind of closing that we've seen in the last week, but that nobody would not get a test who needs, that should and could potentially endanger the community. Now, one of the things I'll say, just as I'm talking about testing, and I was talking to the governor a little while ago, is that some people are surprised at the number that we have in Michigan today. I was not, because we have had limited testing, which means we haven't been able to test as many people. And as private labs and the hospitals come on board, you're going to see more people tested, and the numbers are going to go up. That's just a fact. And this is going up exponentially, and I'm not supposed to say this officially. I mean, nobody says this officially, but there's no way this is just going to be for 2 weeks. If you're listening to the experts, we all know that this is going to be at least several weeks. So that was the first thing that was included in there. For economic security, we have paid emergency leave. And the Families First Coronavirus Act will provide 2 weeks of paid sick leave and up to 3 months of paid family and medical leave for employees at companies under 500 people, filling a critical gap. It's not a perfect solution, and it's going to be improved upon, but it'll expand emergency leave to as many as 87 million U.S. workers. Now, we got a problem here in Michigan, and this is what I have been working on all week, which is the auto industry, which is not captured in there. And the auto industry went down yesterday, and the supplier industry is going to follow. And I don't have answers for all of you right now, but the auto industry contracts do not have paid emergency leave in them. The auto workers at the 3 OEMs that went down yesterday are getting some pay. That's a combination of unemployment and money from the companies. But I don't think, this is just me, Debbie. I think it's going to be longer than 2 weeks, and we're going to have to address that issue, and that's been one of the issues that I've been talking to Democrats and the Speaker about all day. And then it also has enhanced unemployment insurance, which gives states the resources and the flexibility to provide unemployment benefits to the laid off and furloughed workers, as well as to those workers who exhaust their allotted paid leave. So there's going to be more money in there for the hardest hit states in the future if conditions worsen, and that could be. But the states are being overwhelmed with the number of people that are applying, so we're going to need more money in there. On food security, it includes more than $1 billion to provide food to low-income pregnant women and mothers with young children, help the local food banks, and feed low-income seniors. It ensured that the students who depend on schools and child care for free and reduced price meals continue to have access to the nutritious foods during closures. So Bobby Scott made sure that the summer school program will be the infrastructure that we'll use for making sure the kids are getting food. And it provides women, infants, and children with the flexibility to access food and infant formula without having to make unnecessary or unsafe visits to the clinics. And on health security, it increased the federal medical assistance percentage, FNAP, which the federal government provides to state and territorial Medicaid programs. And hopefully this will keep the states from having to cut benefits, reduce their Medicaid rolls, or do higher co-pays or increase costs in any way. So that's kind of what was in what got signed this week. I don't know, does anybody have questions on that before I talk about what we're talking about for the third package? Do you want me to keep going?
Congresswoman, this is Kyle Caldwell. I do have a question. First off, thank you for visiting with us last week in the midst of all this and taking the time today. You're a stalwart champion for the very communities that we're concerned about. As you're thinking about this and thinking about the bill that's before Congress now, we're concerned about nonprofits being major employers as well as small businesses. Is there discussion about relief for nonprofits as employers and small businesses as well?
So I have raised that. There are so many issues that have come to the forefront in the last week when this became real. And I think people are looking at that, but I'm going to make sure that they do because we need the nonprofit community. And we've discussed it. I don't know where the discussions are on that. And we've got a congressional delegation breakfast in the morning, or not a breakfast, none of us are in person, but an 8 o'clock a.m. conference call. And we need to make sure that we've got, if any of you know members, have relationship with members, if you would bring that up. So we need everybody with every voice pushing right now for everything that we have to get. So you should be treated as a small business unless you're over 500. But, you know, when hospitals are said, there are larger nonprofits or 501c3s. So we just have to make sure that you're not caught in some of the bureaucracy of all this.
Thank you.
And to
Other
remember
question?
that folks do have the ability to unmute themselves, or you can use the chat box or the Q&A box, either one. We're monitoring all of them if you have questions.
Why don't I tell you what, I mean, I've been a nonstop call for 5. I am physical distancing, but I'm not social distancing. And I think that this state has become much more serious with the shutdown of the auto industry yesterday. The supplier community is going to follow. There are going to be serious ramifications, and we all know that. And the restaurant community is already in total panic. I've had restaurant owners just of companies that you all know in total tears as they've had to lay off employees and business managers. And this is a time like none that we have ever seen before. And our first priority is to make sure that everybody's safe. We've got to keep them healthy. And I'm going to make this one comment before I start to talk about, there's a lot, I'll sort of lay the framework of what's happening on the third package. But, you know, we need to, the nurses and the doctors on the front line are true heroes, and they do not have the equipment they need. I will be very clear on that. One hospital in 30 days has gone through 5 years of what PPE, or the physical protection equipment. And there are a ton of discussions. We had a conference call with the hospitals this morning about how we're going to get more equipment to them. There are manufacturers in this state that have said that they could try to help produce, but we've got to get the specifications. The autos are having discussions about building these ventilators. The best of America is coming out, but it's a complicated time. But for Michigan, we're a state that's going to be hard hit because we do have manufacturing. And we already had a lot of issues just in the last week, and the auto industry going down is going to make things more complicated in this state. Now, I will say that the governor, on the phone call with the president today, said to the president, Mr. President, what are we going to do about the auto industry? And he said, we're going to take care of it. And I've been working with everybody nonstop. But we don't think the workers that are in the plants, we're not going to get ventilators or masks or groceries or drugs or any of the things we need just to keep us going, like even the Amazon drivers, et cetera, if we don't have people that are willing to work. And we need to thank them. The auto workers felt totally unappreciated and that nobody knew how scared they were or the situation that we were in. And the people that are going to work, we need to thank, because we're not going to get what we need to stay a civil society if there aren't some people that are willing to work. So one of my messages to my colleagues has been, we got to start thanking the workers. But the second part of this is the millennials are not getting this. The millennials need to stay home as well. You know, we're seeing the statistics out of Europe. We're seeing the statistics here in this country. And quite frankly, in this country, 50% of the people that are in intensive care units are between 20 and 50. And the statistics from Europe are, it's approximately 40%. It may be a higher 54 or 60. I don't have it in my head. But these kids are helping to spread it. And we need to all listen and respect what the experts are telling us. Because if 80% of us or 85% of us are doing what we need to do, but 10% or 15% aren't doing it, it's not going to stop. And we are in a mitigation phase right now. So those of you who work with young people, you can help reaffirm that message. But where we are on the third COVID-19 response package is there's a lot of discussions going on. The Senate has their package, and it's starting to circulate. But quite frankly, Democrats are putting together a package too. And this package is going to be the most important one yet. There are so many issues that have come up in the last week, and so many things that have to be addressed. They're all on the table, and everybody's got different priorities. So, you know, it's a really incredible challenge because this is our economy, and we're going to have to, it is a scary time. And what Democrats want to do is put families first. So when people are, the airline industry is obviously an industry that people are already talking about, and I don't think this should be partisan. We've got to find a way that this isn't partisan. But people want to make sure that the airlines aren't getting money that they put into buyback stock options, but that it's money that's going to their workers. So any support that's in this next bill, the Democrats are adamant that it's got to be to help workers. As you know, the White House has suggested sending everybody $1,000 or $2,000 check. Even Republicans, there's some Democrats that think we should do that. There are Democrats that don't. There are Republicans that think we should, and there are Republicans that think we shouldn't. So I would actually say that it's not partisan in any way, but there's sure a lot of different opinions. So there's ongoing discussions of how you put money quickly into the hands of Americans. But a lot of people, and I probably am one of them, thinks we've got to consider solutions which are structural in nature. So how do we expand eligibility for those that are being hit by what's happening for the unemployment insurance? What are we going to do to help small businesses to ensure that their workers are continuing to be paid right now? So all those issues are on the table. We've got to utilize refundable tax credits, including the earned income tax credit and child tax credit. I think that's something that there is agreement on. And our committee chairs are coming up with proposals as we speak and other methods that we can think about that or come up with that can give cash payments to the American people. And you're going to hear a lot of discussion about that. As I said earlier, I'm working with the auto companies, the OEMs, and the suppliers, how we make sure we're not leaving them behind. I would say honestly to you all that I probably am the first person who's been really talking about autos. And Debbie Stabenow and I have been talking all day. It's why we have the delegation meeting tomorrow. And we're trying to get leadership in both houses, the House and the Senate, to really focus on it. And that's why the governor's question to the president was so important today. And we've got to make sure we're not leaving you behind. In the federal response, you're going to be strained. There's no question about it. And you play a critical role. And the role that you play is going to become more important, not less important. One of the notes that I sent to the speaker was that nonprofits in the U.S. comprise 10% of the GDP. And, you know, you employ 470,000 people in Michigan. So I guess I would love any suggestions that you have, but we are saying, I've said to Richie Neal and to others, that any tax relief that's available to businesses has to be available to nonprofits as well. So that's kind of where we are on that. I've had more discussions on this third tranche, and there's a lot of discussion with people probably not settling on where we need to be yet. Yet Mnuchin said to the speaker he wants a bill done by Monday. Now, I don't think that's realistic, but I can tell you they want to get this done. And the Senate wants to act before they leave, and they want to leave. And there's some question as to, just like it's an uneasy time in our communities, Washington's not immune from what's happening. But we need you guys. I guess that's what I would say. It's an all-hands-on-deck effort, and everybody's got to chip in. So I got to help. Our delegation needs to make sure that they're protecting you, and we can't do without you. People are going to need help. They're going to need food, supplies, medical care, and they're going to need to, help keeping the lights on in their home. I'll tell you what's a major issue is I've been working with Rashida on the water, and there's still 3,500 people that don't have water in the city of Detroit, and the mayor set up a program, but these people need help getting the water's been off in some of these houses for so long that it's not an easy job of turning on the water, and we've got to make sure everybody in Michigan's got water. And we're going to, the third launch, I didn't say this, the third tranche is in the Energy and Commerce Committee, which I'm on. Rashida and I've worked with Frank to have a water proposal in there, and committee told me tonight that it would be in there. That that's an area that really is, it's just one example of thousands that we need to be taking care of. So every last one of you on this call is part of the response. And what's frightening is your demand's going to be higher than you've ever seen it. So we got to work together, and you need to know that there are a lot of us that know what you do and appreciate you.
So, Congresswoman, thank you so much, because I think, as we think about the strain on the infrastructure, it is good to know that you are thinking about kind of nonprofits and the role that we play. There is a question, and so we're monitoring the chat box and also the Q&A, so please feel free to utilize those as resources to be able to pose questions. So this question is really around that second tranche, what just got signed. Is there a sense of a timeline in which the support is going to actually hit the ground? So that's the first question, and then there's a second question that goes with that. So I'll just let you respond to that one first.
So people are trying to expedite it and get it to people as quickly as possible. So the money is going to get to the states. This I have to say to you, the White House is really committed to getting this money out. So I think I probably will have more specific answers, but like on unemployment, we want people to be able to access it in a couple of weeks. And the paid family leave is being done in such a way that companies should be doing it now, and then they'll get a tax credit on their tax returns. So we're making every effort to do everything in there as fast as we can.
Thank you. And then another question is, or should I say the second part to that, is also understanding where philanthropy, where are you seeing gaps? So where can philanthropy kind of be helpful? And certainly, again, this group has been in constant conversation and have also been in conversation with the governor's office, but just based on what you're seeing in terms of federal support, where are you seeing the biggest gaps?
So I think it's just sort of hitting. I mean, this last week has been like real. And by the way, it's sort of, parents have been in, what are we going to do about our kids? We need to worry about our first responders. There's nothing it would be great if you could. It's not a matter of money for the PPE, for the first responders, and for our nurses and doctors. We don't have the supply. But water, basic things. So getting the water in Detroit, and it's complicated. They need plumbers. They don't have enough plumbers to do it. But making sure that every person in the state has water is the first thing. Seniors are scared to death to leave their homes. So, you've seen some of the stories of, the stores are trying to do special hours for the seniors, but making sure the seniors have food, maybe volunteers to help shop for the seniors' food, making sure they're taken care of I'm doing this off the top of my head, by the way, is another area. Child care. The governor has done the special order that people don't need to be licensed. I have to tell you that I've heard from a lot of child care licensed who are very worried about that. But how do we do that? And I know I'm talking to all my school superintendents, and people are trying to make sure the food's out there for the kids, but there's shortages. There's, just making sure that people have really basic essentials is something we've got to focus on. And mental health. The anxiety is going to start to set in. People are going to be in their homes for a while. And how are we going to teach the kids? This is like, nobody has said this to me, nobody. So do not anybody quote me. But I think it's going to be really hard for schools to reopen this year. And how are we going to teach our kids so there isn't a gap? And how are we going to reach people that don't have the internet? And how are we going to make sure that they've got access to computers to learn online? They're just really basic things that people don't think about so that, I could probably sit here and brainstorm with you for another, 20 different issues. How are we going to do the census? And that matter is down the road. There are just so many different things, but I think we need to focus on basic human need right now, which is running water, food, medicine, and taking care of mental health. Does that make sense to you all?
It certainly does, and I know that this is a bit difficult because we, as you can imagine, again, going back to infrastructure, the infrastructure has been taxed such that, we're having to utilize Zoom, so it doesn't allow for kind of that real-time interaction. But again, we do ask folks to please feel free to unmute yourselves to ask questions. I think that us at the CMF team, that we are allowing for that to happen, and then you can also utilize the chat box and the Q&A box to ask questions as well. So I'd love to just kind of hear your perspective, or if there's, if you could share from your perspective, if there's any possibility of addressing critical issues for many of the human services and nonprofits and community action agency grantees. So they all exist, and many are reliant upon federal grants. So it's a little bit of a twist on the question that Kyle had lifted up, but they are reliant on federal grants. And so just wondering if that has been part of the conversation in reference to kind of non-federal matches to be waived for some of those grants, et cetera.
It's come up. Probably Rose is really working on some of these issues, and we need to make sure you're getting the funding, because everybody knows that there's going to be more community need, not less. But Rose is working it, and I'm going to talk to her tomorrow, but I've just heard much bigger question. It's that doesn't come out right, but everybody's really worried about how do you keep the economy going, what are you going to do about jobs, what are we going to do about people having income, and so that is as critical as everything, but I haven't heard as much discussion about that.
Thank you. We'd love to be able to follow up with you and other members
Yep.
specifically around that and
You know,
those. Go ahead.
what would be helpful is for you all to put together a list from the Michigan delegation of issues you're worried about in the nonprofit community, so we can take it to a delegation meeting and talk about it.
Thank you. I think that's a fine idea. That and I know that there's been some communication that has gone out individually, but I like the idea of collectively kind of us putting together concerns, and also, quite frankly, lifting up areas where we're being supportive, so that you have that information as well too. Would that be helpful?
Yep.
Okay. There are a lot of community-led organizations, both nonprofit and grassroots, that are trying to figure out how to leverage federal and state funding and other funding to meet the needs. They're also focused on people ready and willing to assist, but they're underfunded. So how do we streamline the process? So I think
I'm going to have to really look. I got to go talk to the experts. Got to talk to the state level, got to talk to the federal, so I can't do this. I'm never going to tell you guys I have answers when I don't. So I got to go dig into this, and will tomorrow. And it's at the federal, state, and local level.
I'm sorry, just another quick question. And again, I'm asking these questions on behalf of our members.
No, I know.
Okay. And so so can you just speak a little bit to kind of plans or things that are happening that you might be aware of around our aging population? That's been another kind of area that we've not heard as much about. So if you don't mind just sharing what you're hearing in that space.
You know, first of all, I want to say, too, that we need to worry about our seniors. I called to check on a senior this week, and that individual said to me, I'm not going outside. I'm afraid to go outside. If I go outside, if I get this, I'm dead. They've already made a decision that my life isn't worth living, and a doctor won't treat me, and they're going to leave me to die. And that really upset me. But I think that some of our senior community feels that way. At the federal and the state level, they have switched, they have several things that they watch at senior homes, critical care, the residents, et cetera. And infection control is now their top priority. And they're really watching that very hard. Then the state and federal people are trying to ensure that the seniors have food, but it's much, if you're at a care facility or a Fox Run where a lot of seniors live, it's either some Fox Runs in quarantine, and I know that the state inspectors are checking that regularly, but we have a lot of seniors in our community that, you hear people saying we need to check on them, call them, see if they need anything. We need to do more for seniors. I will say that. I said that when you asked me what they could be doing. I think the senior that I checked on is probably reflective of how a lot of seniors still in their homes feel and are scared. You see some of the grocery stores doing special senior shopping hours, but what happens, I was on the phone with some doctors today, and what happens if one of them has a medical emergency? You know, how are they even going to be seen? How are they going to keep the regular appointments? Now, we have, at the federal level, we were, Annie Custer and I had different pieces of legislation on Medicare reimbursing for telemedicine, but the president actually, he said in one of his press conferences in the last 24 hours or 48 that Medicare will cover these telephone doctor appointments. But we need to worry about seniors. There's a lot of, and we just need to raise awareness, period, that people need to be sensitive. But there are people, you know, none of these senior centers or the senior centers themselves have canceled their events. But these long-term care facilities, these senior have closed to visitors to keep their residents safe, but that creates a loneliness. And so, you know, even finding a way to use technology to touch seniors, I think is important, and that we need to do that as a community.
Congresswoman, in thinking about kind of, you've experienced both kind of you've experienced the Great Recession and the things that came out of the ARA package. And so just wondering if there are lessons learned from that might be helpful both to for and nonprofits around kind of capacity building and supporting local communities.
So I first want to say that this is not 9/11 in 2008 put together. This is like a time we have never experienced before. And so that's one of the things that we've all been talking about, that as we look at packages, the airline package is much different than 9/11. The auto packages is going to be much different. When you, resilience needs to be built in, and we have to help state and local governments they don't have money, they are stretched. The public health department is stretched. I mean, quite frankly, people just reaching out to public health departments they do need. I don't know what we can do in resources, but this is like more serious than anything we have seen. And quite frankly, I'm trying not to be critical, but public health departments are treating things differently. I'm not going to give specifics, but there was a school that had somebody who was tested positive last week. And that public health department, the person was non-symptomatic while they were in the school that day. And the public health department said nobody was exposed because they were asymptomatic, but they were symptomatic by that evening. And I was like, we know that people are contagious when they're asymptomatic. So telling people that they don't have to worry is irresponsible. I was on the phone with some other people, and it was before the death started to be reported yesterday, but a mayor knew that someone from his community had died and been told by somebody else not to talk about it. It might create panic. And I said, people already don't trust institutions. They don't trust government. And we need people to have a trust in institutions right now. They need to believe they're being told the truth. We need to be transparent on everything. And one, if they think you're lying, they're not going to trust you at a time you need that trust. But two, when people realize that people are dying, maybe it will bring the reality home to some people who aren't taking this as seriously as they need to. The Chrysler, I don't think I'm telling anything out of school. When they had the positive case at Sterling Heights, they took people that particular employee had been in a contained area. The other employees that worked with them were sent home, told to self-quarantine and not tell anybody. Well, they all went on Facebook and told everybody and created panic in the plant. I think one of the things that as you talk about communities and what's happening is people need to be very transparent, not lie to people, be honest about what's happening, and then how do you give people who are facing one of the biggest crises in their life, one, the fear. They're just people that are scared. And then on top of it, they're worried about their job. Will it be there? How are they going to live? How are they going to take care of the child? How are they going to pay for medicine? What happens if they get sick? We haven't seen times like this before. It's not really answering the question, but we haven't seen times like this before. And the work that you all do in the nonprofit sector is it's going to exponentially grow because of the seriousness in the crisis we're in.
Yeah, so I think what we hear you saying is that there's really nothing to compare this to. And quite frankly, you know, we are thinking about the immediacy, and there are immediate needs, but the ripple effect and the long-term impact of this is going to require a significant targeted response.
Correct.
So, yeah. So there's been and you've already touched upon this, but I think it's important to just emphasize that we've seen, I'm looking at some comments from our members around kind of the tax credits that apply to small businesses and recognizing that they don't necessarily have the same impact on nonprofits. And just, again, really emphasizing, and we're going to share this with you in a correspondence and other members of the Michigan delegation around, you know, most nonprofits having a combination of volunteers and underpaid staff, and just recognizing that there should be, we want to ensure that their efforts to make sure that nonprofits are kept whole during this time where they're needed the most.
I think that's important, and I think the sooner you get that letter to us with any recommendations about what you think needs to be included, this bill is moving, so get it to the delegation.
Heard you loud and clear on that.
Thank you.
Mm-hmm. Are there other questions or comments that folks want to make while we have the Congresswoman? Again, you can unmute yourself and feel free to ask. You can also use the Q&A, and then you can also use the chat function. And while folks are either unmuting themselves in the just last remaining minutes that we have, or utilizing either the other two functions, I do want to emphasize for our participants that this is an opportunity for us to engage in a conversation around grant making, around support for nonprofits, around the work that nonprofits are doing, and really making sure that we're having a conversation around where gaps might be. This is not necessarily, and it's a conversation for us. It is not a conversation for media, et cetera. So I think everybody knows that, but I just wanted to make sure that I just called that out. So it really should be considered an off-the-record conversation, again, as the information here is really to be helpful in informing our thinking long-term. And so can you also, and I feel like this is a bit unfair, but you are just, you know, you have been such a champion and friend. Can you maybe speak to also some of the work that you're hearing in terms of what local governments are actually doing?
You know, it depends on what local government you're talking about. If it's the city of Detroit, I haven't talked to Grand Rapids, but I think the larger cities have an infrastructure that is trying to cope with some of this, using their staff is there. They're trying to deal with this myriad of issues that everybody is. But I even see Dearborn and Ann Arbor stretched and asking lots of questions. And then I am doing, for instance, I do a conference call now with my mayors, state legislators, county commissioners, every Monday and every Thursday. And they're looking for answers to the kind of questions that you are. They're trying to figure out what the feds are doing, what's the state doing, what's the county doing. I'm not going to give you any, a lot of them are new at this. So, and every day I learn stuff. In like 2 of the very first coronavirus patients were from a city in my district, and the mayor called an emergency city council meeting, but did not know that the county health department was following the cases, mapping where they had been, had not talked to the county public health department. So he did that connection. But then I was, well, so people have to meet the Open Meetings Act. But when you start to get panicked, how many people are going to come to a meeting, and is that it's clearly going to be a larger gathering. It's, you know, the governor has now, initially she did it at state level. We've got I had thought that the local notice had been done, but she got it out yesterday after the call, so that now when a council meets or a local level of government meets, they can transmit it electronically so they can meet the Open Meetings Act, but you don't have people going and attending that meeting. I mean, people are learning. I mean, this is unlike something that anybody's ever really thought about. So that's where you get a mayor on the phone saying, do I tell people that someone died? Who do I call? What do I do to take care of people? There are a lot of people are struggling, and a lot of these city governments have closed under these circumstances and are not, I have a police department that's not a large one in my district, that half of the department has tested, and that test should be back today. I mean, people just really don't understand what's happening. And then when you have a first responder, and like one of the other bureaucracy things was that we've got to get the president to open this, the national supply, but firefighters didn't meet the paramedics that are the first responders weren't eligible for the PPE. So we had to get that changed at a regulatory level. You learn things every day that you don't even think about that become part of the next thing you've got to get fixed.
Jennifer, I see that your hand is raised.
Yeah, well, no, I had typed a message, and I just wasn't, I came late, so I didn't know all the protocol for but I'm just, being with the foundation and a family foundation, and being that our resources are now, of course, our corpus is now depleted. One, I'm going to say thank you very much for making the excise tax a single level, because it could be indicative of what's going on in the stock market right now. But the other thing I was going to say was that, are there places in Michigan that would be more, what's the right word, more effective to give funding to than others?
I'll talk to the governor about that, but you'd be surprised that cities that you think are well off have got needy packets too, and each of you comes from different areas and knows your communities. But
Right.
I'm going to talk to her and tell her that I was on the phone with you tonight and see if she's got any thoughts that I can share.
Well, that would be great, because if there was something where, you've thought that we could make a bigger bang for our buck. Otherwise, we're going to keep working in our individual communities and working with, I'm in touch with organizations that deal with at-risk youth or homeless youth, and they can't shut their doors. No, but they can say, we can't have visitors, but we can't shut our doors. So what do we do? and they're doing what they can, and they're doing the best that they can, and they've canceled volunteer trainings, and they've canceled, anybody coming from outside, except for the people who need them. So, I'm just saying I'm really at a loss as to which way to turn.
Everybody is. So
Yeah, no, I get that. And I just got to tell you, I emailed or I texted a friend tonight, earlier this afternoon at 2:00, and I went, okay, I'm at home and I'm so bored. And I know that's not part of your life because you got plenty of stuff to read. But if you want to shift some of that reading over to me, well, okay. But if you want to shift any reading to me, I'd be happy to read it because I just need some more. I need information that I'm like every time I turn on CNN, I get so panicked that I don't know what to do. So
let me try
I keep the TV off.
No, I know. So we'll all stay together.
Yeah.
And I'll find material for you all to read and that kind of stuff too.
Thank you. But we want to help and we can help. And I swear to God, if the president sends me a check for $1,000, it's an immediate donation.
Well, I think the Senate just put out their bill and they want to give checks of $1,200 for taxpayers and limit paid leave. And I'm trying not to be political.
Yeah, but I think it has an income.
Oh, does it? I haven't seen
mandate
it
on it.
You.
Yeah, I think I don't remember what it is, but it seems quite high actually, but I don't know what it is.
So
well, I know that phone calls I was on today that there was discussion. Some people thought it should be 50, and then Nancy said that there had been discussion so that they were beginning to think 75. But there are so many discussions that, just stay tuned. It's going to be a lot of discussion over the next few days. And if there are things people think we need to be doing, tell us.
Yeah.
Right.
And so that's why I do think it is so important what the advice that you provided in terms of getting to you and the Michigan delegation information and our recommendations. And so we're committed to doing just that. So I first and foremost just want to express appreciation to you, Congresswoman Dingell, for taking time. I know that there's so many demands on your calendar.
No.
So we really do appreciate you taking time to talk with us. And, we're going to continue to feed you information, and we want you to continue to feed us information
Please.
As you're hearing things.
Well, I thank you, and I'm sorry I don't have answers to everything, but I'm trying.
I don't think anybody has answers to everything right now, but thank you so much for the meeting. And really appreciate hearing your voice and your thoughts on everything because you're very thoughtful.
Thank you, and I'm around, and let's all keep talking.
Okay.
Yes, please. Thank you. Appreciate that.
Thank you.
Thank
Take care. Thanks.
Okay.
Bye-bye.
Good night. Good evening.